Mental health continues to be a major issue. A new nonprofit is helping meet that need. Grit Healthcare New Jersey has opened in Fairfield with in person and virtual mental health services. Laura Del Tufo is the co CEO and joins us to talk about the organization's mission. Good morning to you, Laura. Good to have you on.
Hi, good morning. Thanks for having me.
Good to have you. Well, yeah, just thinking about the NJ Transit issues makes me want to call you folks just for that alone. What led to have you and your co-founder launch Grit Healthcare New Jersey?
Well, I certainly think we are experiencing a mental health crisis these days. Post COVID, we're really in some difficult times, and we saw that there were very long wait lists at community mental health centers. Often, individuals had to wait 2 or 3 months before they could get an appointment. If they had the funds to go to a private practice or they had insurance that would pay for a private practice, they would, be able to get an appointment fairly quickly. But for those that don't have those funds or are covered by Medicaid, the wait lists were very long. So we wanted to open up access for those individuals.
All right. And a lot of local leaders came to your opening. So, what does that say about the need for your services? Clearly, they recognize it.
They did. We were so incredibly grateful for Assemblyman Barlas came and Mayor Galise attended as well. I think it just shows the support of the town. It's a very close-knit community, and they were incredibly supportive. They recognized that there is a need, and they were very welcoming to us.
Oh, my goodness. Well, that's a good thing. Do you see yourselves expanding beyond Fairfield? I mean, because the need is so big, not just in Fairfield, clearly, but much of New Jersey.
Absolutely. What I'm finding actually a lot of individuals want in-person services. So those that are located close to Fairfield, they've been coming into the office, but we offer the virtual care because we want to be able to offer our services to anyone in New Jersey, but we are happy to expand our in-person services in the future as well.
All right. And you offer therapy to everything from therapy to medication management. So, why is it so important to sort of have everything under the umbrella under one roof?
It is wraparound care is incredibly important. It's been shown to improve outcomes and help individuals be more successful in meeting their goals. Some individuals just need someone to talk to. They need some additional strategies. Some would benefit from some medication management. That's why we offer that. But we know how important case management and care coordination is, and not all individuals offer that. And we really made sure that was a priority for us. Some people just do not have the ability to make doctor's appointments or follow-ups or, have all of the other elements of their lives in place, and we're able to assist them with that. And it really does improve their outcomes.
I will say this, I have a 95-year-old dad who's a veteran, and so he does have, private healthcare as well and goes to his private doctor, but he goes, and this is of course on a much larger scale, but he goes to a VA hospital for certain things as well. And they do everything under the one roof. I never thought that a government-run hospital like that could be anything decent. I thought it was going to be a nightmare the first time I took him. It is extremely well organized, and there is something to be said about, the general practitioner looks at him and says, "Oh, you need to have your ears cleaned out. Go down to the audiology. Walk into audiology." They say, "Oh, you know what? You could probably benefit from a new pair of glasses." You go over to, and it's amazing because it's all under the one roof, especially now when you're dealing with people with transportation issues and elderly and whatnot. It really does make a difference, and I'm sure you've seen that with your patients.
Absolutely. We do everything we can to remove the barriers, and any barrier, as you mentioned, transportation or just another appointment or trying to fit something into their schedule can lead people to just not accessing those services. So we're there to provide as much under our roof, but also help coordinate additional services.
So important. What do you think is leading to so much of the stress? Is it a monetary thing? Is it a government thing? We just see so much right now, the stress levels, and so many people now seeking some mental health counseling.
Absolutely. I think we live in some tough times. Certainly in the area that we live in, there's financial strains. We're seeing that with a lot of the individuals that we're working with. Anxiety and depression is what's presenting the most at our organization, but also relational issues. It's great to see. I'm seeing more men come in for services. There was a stigma in the past, and I think we've worked really hard to sort of break that stigma. And they're really coming in to work on some conflict within the relationship.
Yeah. I have a friend who's a geriatrician, who said that now we're seeing, what used to be a rarity of somebody living to be 100. He says, I got about 50 clients who are 50 patients who are 100 years old. And we're helping people live longer, but he talked about the fact that many of them, they've lost all their friends, they've lost many family members, and there's a lot of sadness and depression among those people. And I think a lot of people, especially older people, have that mindset of, if you go for mental health treatment, you're weak or there's something wrong with you. Instead of looking at it as any other medical case to be treated, right? It's, if you have a flu, you'll go to the doctor. If you have a cold, you go to the, if you have a depression, stress, anxiety, why is that old school mentality still there where people think there's something wrong or weak about going for mental health?
Absolutely. And it can only help you. It's for anyone, it's nice to have another individual that can just help you see a different perspective, be a listening ear, and maybe just offer some strategies that you hadn't thought about. There's no harm in it. So I encourage anyone just to reach out if they feel any sort of stress, anxiety, or depression.
Yeah, it really does make all the difference. And just if you think about it as just another kind of illness, then you realize that, yeah, you would treat any other illness. Why wouldn't you treat depression or stress, et cetera? Treat it. And today, with especially with telemed, you folks offer telemed as well, right?
We do. It's so convenient. It's so easy. You can, on your lunch break, if you want to have services, we see people, in the middle of the day. We see people right after work. If they have an hour to set aside on the weekends, we're available. We offer hours specifically to meet the needs of everybody. We're open from 9 to 9, so whether that's in person or virtual, but we also offer weekend hours. I'm a marriage and family therapist myself, so I know how important it is for parents that have very busy schedules themselves and their children have all different sports and activities. Sometimes the only availability you have is the weekend, so we want to make sure that we're available to those people.
Laura, what's a website for people to get more information?
Our website is grithealthcarenj.org.
All right. And we thank Laura Del Tufo, the co-CEO of Grit Healthcare New Jersey in Fairfield, for coming on this morning. And I'm sure we'll have you back on when you have 10 more locations on. We hope to see you back here soon. Thank you so much, Laura.
Thank you very much.